Thank you so much. My name is KEBBA CAMARA, and this edition I will call special edition here on Echo TV International. My guest is Mohamed Lamin Kamara. He's a health worker. Of course, also he has a foundation that is helping a lot of Gambians, especially people with heart and cardiac issues. Mohamed Lamin Kamara is just coming from the airport where he actually was the one behind the successful trip of one woman in Mandinaring, Salimata Silla and Salimata Silla and Aliu Silla, who were in Istanbul, Turkey, for 2 weeks. My guest will tell us more about the ML Foundation, how they operate, and other issues. Thank you so much, Mohamed Lamin. Just as I said in the introduction, you actually have a very important foundation in this country called the ML Heart Foundation. We just from witnessing one of your patients coming from Istanbul. It's not easy taking people for overseas treatment, and I'm sure when you tell people that you do take people for overseas treatment, your phone will be busy, your office will be busy, because Gambia lack a lot of things, especially health. We lack a lot of things in our health facility. When you also say heart, I'm aware of how people struggle in this country when they have heart issues, when they have heart problems. And you say your foundation is for heart. So already I can imagine that you don't sleep at night. You are very busy during the day because heart is an issue in this country. First of all, why do you specifically say heart foundation? And how are you operating in this country? After introducing yourself.
Alhamdulillah, Mr. Kiba. I'm Mr. Modlamin Kamara, the founder of ML Heart Foundation. I named foundation after me. ML means Modlamin. Yeah. I come with this great initiative of ML Foundations. I've been working with cancer patients since 2014. I'm a staff of RBTH, currently called FSDH. Yeah, I'm working there. So I do work at the clinic, cardiac clinics. So I see how patients struggle, especially cardiac patients. So I have this strong relationship with the patients, with their parents also. So since that time, I decided to work on my own foundations. Yeah, from my own foundation. So before having my own foundation, I do help patients to travel to overseas treatment.
Overseas treatment.
Yeah, especially like country like Spain. I have one partner there.
Okay, it's Spain.
Mariama, the husband used to work one of the biggest hospitals in Barcelona.
Okay.
So they do take patients for treatment. So we do take patients yearly, at times 1 or 2 patients go for treatment. Yeah.
Okay. So let's discuss about Salimata and her son Aliu Silla. How did you meet them, and how do you facilitate their trip to Istanbul?
Yeah, Alu is part of my patient since 2014. I know them since 2014 at at the clinic there. When I was at the clinic, pediatric clinic. So like because they know that I used to coordinate so many like coordinate so many patients to go for treatment. So they used to say that Molan don't forget us. So I said, well, if God by God willing, if your time comes, inshallah you'll have it. So I was there last year, 2021.
2021.
Yeah, so I met them. I asked him what. By then, Alu was having some crisis. He came to the hospital for medication, so he was on oxygen. Alu, yeah. I think I'm having that photo with me.
Okay.
Yeah, later probably I can say.
Okay.
Yeah. So I take a photo of Alu, then I ask her mother to provide a passport. I will take Alu to Spain for treatment. So I communicate my guys there, then I send that photo to them. So they accepted Alu. Then I called the mom again. I told her that please can you find passport for Alu? I will be going for Spain for treatment.
Okay.
So but by then there was another patient who was on the queue.
Okay, to go to Spain.
Yeah, to go to Spain. His name is Abdullah Toure, living at Lame.
Okay.
So we used to take it one at a
Bye
time.
bye.
Yeah, bye. So like that was 2021.
21, yeah.
Yeah. So like around November, I met a guy, a Turkish guy. So we communicate. Then I send all my details to him that I am modeling working at the hospital. I do have patients who need this cardiac surgery. So they need help. So he said, well, I can help. You understand? That's how I get to know with that person.
Okay.
So we share contacts. I send alus and other patients, almost 7 patients, I think 6 patients for my first part. All of them have their visas.
Oh.
Yeah, the other one will be going. 2 patients will be going on the 30th of January. This year, inshallah.
Okay. So how is this thing done? With ticketing, taking somebody to abroad is expensive.
Yeah.
I don't know how is it funded. They ask for visa fees. They ask for air ticket. Apart from the visa, there are a lot of expenditures that is being made. Tell us something about this.
Yeah, these are the challenges that I'm facing currently now. Yeah, because like I'm not that strong. I'm not financially strong. This is a new organization which I launched this year. You understand? And Alu is part of the first patient that I take from ML Heart Foundation. You understand? So the challenges are because there are documents that you know that is prepared by the embassies. You understand? And also there are other documents that you know that is prepared by the Turkish embassy. Yeah, so which are like we have to finance all those documents to have it. Yeah. So for them, for their bodies, the parents contributed for themselves, but it's even difficult for them.
For them, yeah.
Yeah. So that's why I didn't come with this initiation to create my own foundation so that I follow out funds for them. They can we can tackle those kind of problems for the patients.
Okay.
Because like you cannot say the patient, I want to help you to go for treatment, and you cannot even provide those petty expenses. Not to talk of the air tickets to come to this ticketing also. The time I met the guy, like he said to me that look, we can provide the treatment, but air ticket. I said no, don't worry, the tickets I'll take care of them. You understand? Because
we are thinking that fun,
because like the treatment is almost, let's say it can cost almost 400 to 500 depending on the cost. You understand the type of the diagnosis. You know, heart have different diagnoses. You understand? So the complicated the treatment is, the expensive the cost is. So you understand? So I think of like maybe the ticket is around 50 or 60 or $70,000. You understand? So the treatment is more than that.
It's more than
if
that.
I have the treatment, why can I struggle for I can go and look for funds for the ticketing and other things like that. So I convinced the man. Then they send me the invitation and other things. So we apply for the visa. We have the visa. The man texts me. So when we are expecting this patient, when are you buying their tickets? I said, well, you know, we are from the elections, so I cannot tap funds from any government institute or to private because of this election. So he said, okay, well, I will still try to lobby our tickets for you guys. So that's how he even helped me for the ticket.
For the ticket, wow. So you will need financial support from the government and from NGOs and institutions to be helping sometimes financially, because 50% is done by your organization.
Yeah, for sure. Yeah, currently the 100% this thing for our phone is for the Turkey guys are sponsoring for 100% because of this condition I laid out for them. But probably in future I'll be responsible for ticketing and accommodation. They already even send me the invoices of the accommodations. Yeah, seriously, before these patients. You understand? Before God come to my rescue.
Yeah, I know. Yeah. So what happens with absconds? I understand sometimes you have people going to Spain, people going to Europe. Do you have any problems of sometimes you an escort of a patient or a patient go and will not come back?
Yeah, for that of Spain case that happens. There's one lady, I will not identify her name, but I think she's a lady of Brikama. You know, like before going, I used to, talk to them briefly about the country they are going and also the consequences when you abscond, because you will jeopardize other patients' chances, opportunity. You understand? So they will be just telling me that, no, I swear I will not be doing this. I'm a family man and I'm a Muslim. This and that. You understand? But it's very difficult. But when they go there, they immediately change their mind. You understand? So even someone who don't abscond, but they will have these family members who will be personally
telling them, don't come here.
Don't come here. Here is, But you have to think about the patients who live behind. You understand? Because when you abscond, you stop other patients from going to to benefit from the treatment. It is not fair.
What do you see in the faces of Salimata and Ali when they came back today from Istanbul?
They were super joy, I can say, because they were happy. You don't have the mom saying that almost 11 good years they are struggling for this condition. which is very heart-touching, seriously. Like, could you imagine, for example, I put myself in their shoes.
That's okay.
Yeah, like someone taking medication for 11 good years. At times, the medication will not be available at the hospital. You understand? They have to go outside pharmacy to buy the medication for themselves, for the kids. So now someone come to rescue, and no more medication probably after 6 months. Because he said that after operation, they advise him he will not take any medication. Then after 6 months, he'll go back again to it. So he'll go and do the echo, which I will link him with one of my board members, the cardiologist at FSPA, Dr. Gede. Yeah. After 6 months, Dr. Gede will conduct echo for him. If there is no problem, then he will continue with that medications. Yeah.
So when is the next batch going to any of these countries from the Gambia, from ML Foundation?
Yeah, it will be on the 30th of January. 2 patients will depart from Banjul to Istanbul.
Istanbul, okay.
Yeah, inshallah.
Okay. And usually when they come back, you are satisfied with the treatment?
Yeah, satisfied, because these are competent doctors. They have sophisticated materials to do their job in Turkey.
Okay. Yeah. So, COVID period, traveling, do they require a lot of things from the patients and their escorts? Because now things are different when it comes to traveling. I don't know whether they require a lot of documentations, injections, and stuff like that. Before.
Yeah, what they require is like vaccine certificate. They have to be vaccinated. Sorry. Yeah, first before going, and they have to go with the certificate showing that they have taken their vaccine, and also COVID test results.
Okay. Yeah. Who is qualified for this? I understand that there's an age bracket, and many people are calling you, many people are contacting you, that they want help. If somebody is listening or viewing this program and say, who is qualified for this?
Yeah, the qualified candidates, patients are from 0 years, because at times you have conditions that are some months old, maybe 1 month old cardiac conditions. Yeah, they are qualified to 17 to 18 years. So yeah, we are considering those kind of patients. But for patients that are like pediatric patients, they will go with escort.
Escort.
Yeah, okay. But adult patients like from, for example, 15 years to 17,
they go alone.
Yeah. Okay. But there are competent nurses there also who will be taking good care of those patients.
Okay. All right. You have any email contact you want to share or telephone number?
Yeah, I'm having my NGO ML Foundation email. That is ML Heart Foundation at yahoo.com.
Okay.
Yeah, you can email us with that, and also telephone number 217 6685. That is my personal number. That is on WhatsApp. But my other number is 2177450.
Okay.
2177450. You can easily to me on that. Okay. Then we can see what to do.
Okay. ML Foundation, as I mentioned, that they are out helping Gambians, especially those who are 0 to 17 years old, cardiac, mostly heart issues. Is that what they dealt on? Yes, before I go, some people may come with other issues. I know today people call you and tell you, my stomach is paining, my disease. So those ones are not qualified.
Yeah, like other issues, like I do have hard to help them, you understand? But like, we have a limited, for my own point area, ML Heart Foundation, we have a limited fund. We are not that strong organization. Yeah. We are tapping out funds from individuals, companies for now. We are looking help from them. If they can help us, if we have sufficient fund, we can even consider other chronic illness. Okay. Yeah, seriously.
You had the contact details there if you want to get in touch with ML Foundation. Thank you.